I have got information. I discovered something about bone cancer. My father died of it. Oh, I'm sorry for your loss. Good. Bone cancer can originate in any bone in the body, but in most cases it affects the pelvis or legs, bones in the arms and legs. Bone cancer is rare. It represents less than 1% of all types of cancer. In fact, non-cancerous bone tumors are much more frequent than cancerous bone. And that is strange. Yes, it is, and you should listen to the rest. Yes, explain me. The term bone cancer does not include the types of cancer that originate in another part of the body and spread metastases to the bones. Instead, these types of the cancer are called according to where they originate. For example, breast cancer that metastases to the bones. Some types of bone cancer manifest themselves mostly in children, while others mainly affect adults. Surgical excision is the most frequent treatment.
A few moments later.
Surgical excision is the most frequent treatment. Both chemotherapy and radiotherapy can also be used. The decision to use surgery, the chemotherapy or radiotherapy, is based on the type of bone cancer that you want to treat. Types: chondrosarcoma, osteosarcoma, Epstein sarcoma. Symptoms: the signs and symptoms of the bone cancer include the following. Really, all these are types.
2,000 years later.
Really, all these are types of cancer? Yes, really, it's amazing. When at swelling and tenderness near the affected area, bone weakness which causes fractures, fatigue, involuntary weight loss. When should you consult a doctor?
So much later that the old narrator got tired of waiting and they had to hire a new one.
A consultation with your doctor if you or your child begin to have bone pain with the following characteristics: goes and comes, works at night, over-the-counter pain relievers don't relieve it, request a consultation at Mayo Clinic. Causes: the cause of case of bone cancer is unknown. A small percentage of bone cancer cases have been related to hereditary. There are different types of bone cancer depending on the type of cell where the cancer began. The most common types of bone cancer are the following. Osteosarcoma. Osteosarcoma is the most common type of bone cancer. Is the tumor cancer cells produce bone. This variety of cancers occurs most often in children and young adults. In the bones of the leg or arm, in exceptional circumstances, osteosarcomas may arise outside the bones. Extraskeletal osteosarcomas. Oh, I know one disease. Chondrosarcoma is the second most common type of bone cancer. It is tumor cancer cells produce cartilage. Chondrosarcoma usually occurs in the pelvis, legs, or arms in middle-aged adults and older adults. Edwin sarcomas appear most frequently in the pelvis, legs, or arms in middle-aged adults and older adults. Edwin sarcomas appear most frequently in the pelvis, legs, or arms of children and young adults. Yes, too. Risk factors. The causes of bone cancer are not clear. However, doctors have found certain factors that are associated with an increased risk, including inherited genetic syndromes, certain rare genetic syndromes inherited from the family increase the risk of bone cancer, including Leigh-Fraumeni syndrome and hereditary retinoplasma, Behçet's disease of bone, seen mainly in adults, may increase the risk of bone cancer developing in the future. Yes, radiation therapy for cancer exposures relates dose of radiation such as those emitted during radiation therapy for cancer increases the risk of future bone cancer. Yes. 2. Mayo Clinic of Rochester, Minnesota, and Mayo Clinic Phoenix, Scottsdale, Arizona occupy the top position among the best trauma hospitals according to the USA rating. Johnny Ben, this is traumatic, and again I'm sorry about your. Don't worry, I miss him. Well, I have to go. See you.